My name is Tom Biernacki, and I'm going to tell you how long this broken ankle right here is going to keep you off your feet. So did the doctor tell you your summer is over? Well, see if he's telling the truth. Keep watching. There are a few different breaks that you could have. It is theoretically possible to break just one bone in the ankle somewhere where it's not displaced, means something did not pop out of place. And number two, that means you can keep walking on this, potentially in a walking cast or a brace. At the same time, there are different breaks. You can have 2 broken bones, 3 broken bones. Some of these bones might have shifted. So as you can see, if it's just a crack where nothing has shifted and it's a safer bone, that means you could probably walk with some protection almost right away. This might not mean you could play sports right away, but depending on where the break is, it might mean you can start moving right away and be reasonably safe. These are things like smaller avulsion fractures, non-displaced fractures. On the other hand, you have the big breaks at the end. These are called a trimalleolar fracture. This is when this bone breaks, this bone right here breaks, and the back breaks. So you can see this bone right here. That's called the trimalleolar. If all of those break out, if your bone shifts out and pops out like this, you could see something like that is more likely to need surgery and you're going to be off your feet for a very, very long time. So the lighter ones, you're talking walking right away. The bigger displaced ones, you're talking surgery within the first 2 weeks and probably in a cast for 6 to 8 weeks, and then a walking boot for another 6 weeks, and then a brace for 6 more weeks. So you're talking a very, very long time. This is the anatomy of the ankle. So in between here, you have your ankle syndesmosis. This is what could be damaged in a high ankle sprain. So these 2 bones could dislocate and separate. That's one part of the break. This is your fibula right here. The fibula could crack through here. That's called a fibular fracture. You could also have a medial malleolus fracture. So this is the medial malleolus of the tibia bone. So if they both break, that's called a bimalleolar fracture. If these 2 break right here, plus the bone in the back right here, you could see on the tibia right there. If all 3 break, that's called the trimalleolar fracture. And that means that these could dislocate very easily. If that dislocates, you're in trouble. This bone right here is called your talus. If that pops out, you're in even more trouble. Sometimes more bones could break. So when you think you broke your ankle, you could actually break this 5th metatarsal bone right here. So obviously, the more bones break, the more likely you're going to need surgery and the more you're off your feet. Here's what you could do at home. How do you tell if it's actually broken or not? Number 1, how messed up is the ankle joint? If it's big, dark, black, and dislocated, there's a good chance that it's broken. But number 2, if it's not dislocated, if there's not a lot of black bruising, odds are it's towards a more non-surgical problem. But here's how we get more detailed. There's something called the Ottawa ankle rules. So what we look at on this foot model is the Ottawa ankle rules basically tell you is feel the bone. So as you feel down the fibula, if it hurts, go see your podiatrist. And then on the outside, touch your 5th metatarsal. If that hurts, go see your podiatrist. So feel the bones. If it's the soft tissue around there, if it's the skin, if it's not actually the bone, it's more likely to be the ankle sprain. And you also do the same thing on the inside. So touch your medial malleolus and tibia. Does that hurt? Or touch your navicular right here, touch your talus, touch the bones. If the bones are aching, very likely it's a bone problem. If the bones are not aching, it's most likely a sprained ankle or some type of soft tissue injury. That is 98% effective at telling you whether you have a break or not. But 30% of the time, it's too aggressive and you don't actually have a break. So just keep that in mind. Better to be safe than sorry. Here's how you tell if you need surgery. So as I was saying, sometimes you can get an avulsion fracture. So sometimes just the tip of the fibula could be chipped. that's something you could probably be protected in a brace and walk on. But if you really break and dislocate the bone, there's two ways to go about it. The less healthy you are, so if you have heart problems, diabetes, are a very poor surgical candidate, because other things in your health are going awry, then you're less likely to lean towards surgery, and you have to talk with your foot and ankle specialist, or your podiatrist about that. At the same time, if you break both the medial malleolus and fibula at the same time and the bones shift, you're much more likely to need surgery. At the same time, if you break the medial malleolus, the fibula, and the posterior malleolus right here, and the bones start to dislocate, if there's any shifting like that, you very likely need surgery because your ankle just won't work. Visiting your podiatrist. So what can we do for you in the office? As you can see, in your ankle joint, there's a lot of stuff here. There's a lot going on here. There's muscles, ligaments, tendons. If your foot is hurting, it could be more than just a broken ankle, or a lot less than a broken ankle. Most of the time, it's a lot less. So here's what we would do. Number one, we'd start with X-ray imaging. Number two, with an X-ray, you can usually tell what's going on. Sometimes then a CT scan is a stronger, supercharged X-ray that can give a 3D image. It takes lots and lots of X-rays and combines them into one. If we think ligaments and tendons are damaged, so you could see there's a lot of them right here, something called an MRI is really good for soft tissue analysis. So this is one of these things where there really is no home treatment guide. You got to be safe with ankle fracture.
Hey, guess what? We have a phenomenal book. I believe this is the premier book on chronic nerve pain and peripheral neuropathy pain on the planet. I've put years of work seeing tens of thousands of peripheral neuropathy patients, working with some of the best diabetic endocrinologists, the best doctors, the best neurologists, in building out this book. For you, my viewers, we have a discount code available. Get on our mailing list and get that book down here.